Hi, I'm Aldrich-Bennett, a physiotherapist, and this is Barcode Play Show.
Hi, and good day. Welcome to Barcode Play Show, and this is Spotlight. Today's program is sponsored by PASS. I'm your host, Ilechukwu Alex. Welcome. Today we are shining the light on a vital profession that helps us move, heal, and live life to the fullest. Please join me in welcoming our first guest, Sir Aldrich-Bennett, a dedicated and passionate physiotherapist. Physiotherapy, also known as physical therapy, is a healthcare profession that focuses on restoring mobility, strength, and function to individuals affected by injury, illness, or disability. From sports injury to chronic conditions, physiotherapists play a crucial role in improving our overall well-being. Sir Aldrich-Bennett has been a practicing physiotherapist for about 17 years with a wealth of experience in sports medicine, neurology, women's health, cardiopulmonary, community health, geriatrics, and pediatrics. Today, he will share his insights on the importance of physiotherapy, success stories, and tips for maintaining a healthy lifestyle. Let's dive into the world of Spotlight and explore the world of physiotherapy together. Welcome, Doc. Morning, Doc. Welcome. How is Abuja today?
Abuja is fine as usual. A little rainy, but the weather is okay.
And I believe our president is doing wonderfully well.
Sure.
Okay, please, can you start by explaining what a physiotherapist does and how they contribute to healthcare?
The best way to go about it is to define a physiotherapist and physiotherapy. So in the definition, it will capture what we do and what we contribute to healthcare. So if I'm to give you a very simple definition of a physiotherapist, I will say a physiotherapist is a movement specialist who analyzes and treats movement dysfunction. A movement specialist that analyzes and treats movement dysfunction. So if I want to give you a more comprehensive definition of physiotherapy and physiotherapists, I would say physiotherapy is a doctoring profession that produces physiotherapists who are healthcare professionals who are licensed to develop, maintain in people using non-invasive means like exercise therapy, manipulative therapy, cryotherapy, hydrotherapy, and invasive means such as acupuncture, dry needling, after we must have examined the patient, evaluated the patient, drawn up a diagnosis, come up with a prognosis, drawn up a plan of care, put the necessary interventions in place, review this patient, and then discharge this patient. So in this second definition, it encompasses and captures what physiotherapy is and who a physiotherapist is. So in a nutshell, physiotherapy is the profession, physiotherapist is the professional. So that should explain it better.
So, well, it's still it's just like when you go to a mechanic, they have you have the electrician, you have those that work in a particular. So physiotherapy and physiotherapist is a branch in medical line. So they focus on a particular area. Okay, what's the typical educational path? Okay, so what's the typical educational pathway for becoming a physiotherapist, and how many years does it typically take?
Before now, in Nigeria, we used to have physiotherapy. Right now, we have doctor of physiotherapy. So let me start with physiotherapy. After you've gotten admission into a university, you do 5 years of a physiotherapy program, degree program, then come out, go for 1 year internship and 1 year youth service. So it used to be 7 years. But right now, what we have is doctor of physiotherapy. So you get into school and do 6 years of academic degree work and come out as a doctor of physiotherapy. Now, the people that have done the 5-year program and gone for youth service and done the internship can now upgrade their bachelor's of physiotherapy to doctor of physiotherapy by doing transitional program for 1 year or 2 years, as the case may be. So it's either a 5-year program for you to become a physiotherapist or a 6-year program for you to become doctor of physiotherapy. But by 2030, there won't be any university offering the 5-year program because it will be phased out. So we're now transitioning the people that have the bachelor's to have doctor of physiotherapy by doing a transitional program for 1 or 2 years. So that's the educational pathway.
Okay. So before now, people that graduated in physiotherapy with a BSc, that's bachelor's degree in physiotherapy, they are not called doctors, before now, until they upgrade their certificate to.
No.
Okay.
Okay.
Nevertheless, we'll get to that.
Okay.
Yeah, we'll get to that. Okay. So now, what's the difference between a physiotherapist and a doctor of physiotherapy? That's DPT.
Now, the difference, like I said, a physiotherapist did the 5-year program with 1 year internship and 1 year youth service afterwards. A doctor of physiotherapy did the 6-year program with 1 year of internship again and 1 year youth service. Right now, a physiotherapist can upgrade to doctor of physiotherapy by doing the transitional program of 1 or 2 years. After these 7 to 8 years, you're also expected as a clinician to go into specialization. I heard you mention the different specialties like sports medicine, geriatrics, pediatrics, community health, neurology, and a whole lot of them, cardiopulmonary. So you choose one to specialize. So in essence, after doing the degree program of 6 years for doctor of physiotherapy, 1 year internship, 1 year utilize 8 years, you still go back and specialize within 2 to 3 years, depending on where you enter the program of specialization. So that is the difference between a physiotherapist and a doctor of physiotherapy. However, both are still referred to as doctors because of their function. You can answer a doctor either by your degree title, like doctor of physiotherapy, doctor of this, doctor of that, or a function you do. When I was giving you the comprehensive definition of physiotherapy, I said we examine patients, we evaluate patients, we come up with a diagnosis, drop a prognosis, drop plan of intervention, deploy this intervention, review this patient, and possibly discharge. So in the function lies our answering doctor, even as a physiotherapist, is the function that we do that enables us to answer doctor. Because you can evaluate a patient, examine a patient, drop your own diagnosis, deploy plan of care, review and discharge. If you're not a doctor, what are you?
Oh, well, this your comprehensive answer has in fact nullified my fourth question, which is why are physiotherapists sometimes referred to as doctors? So you've already actually answered that. Okay, nevertheless, let's look at insights and experiences. What inspired you to pursue a career in physiotherapy, and what has been the most rewarding part of the job so far?
It's the smile that the patient gives you at the end of the day. I mean, when a patient recovers. Let me give you an instance. A patient comes in with severe low back pain and cannot function, cannot move. But in 1 or 2 treatment sections, you are able to resolve that. And the patient is happy. You see it instantly. The patient can walk better. The patient can function better. Remember, I said we are movement specialists. So anything that affects movement, that's what we look out for. So we are able to restore your movement back to what it ought to be. And that's satisfaction. We're able to help this patient without necessarily telling him to go and take medication or do something out of the ordinary. And remember, in my comprehensive definition, we play 3 roles. We develop or restore maximum movement and function. We develop it in people that don't have it before. Let's say children that were born with congenital abnormalities, they were born with defects and cannot move. What we describe as delayed developmental milestone. Maybe a child is supposed to walk at a certain age, but cannot. Now help the child to develop it. We maintain it in people that are healthy, like you to lose that. We want you to maintain it for as long as you are alive. Then also, we restore it in people who had it before and for some reason lost it due to ill health, maybe accident or whatever it is. So we develop, maintain, and or restore. So when you do this for a patient and you see the patient coming out happy, moving better, enjoying better quality of life, that is the satisfaction it gives us.
Wonderful. Just like the satisfaction probably most people get from their profession, like when a broken down car is brought to a mechanic and then he restores the car and then the client is able to drive out with the car. I think the satisfaction is fulfilling. Now, can you share a brief story about a patient who has made significant progress through physiotherapy? Some years ago, I was discussing with you, and you shared some of this stuff with me that was mind blowing. That I remember telling you there was a time I visited orthopedic hospital in Enugu, and I went to burns unit, and I saw a patient that was totally burnt, from head to toe, in fact, without eyes, and then she was breathing from tube and the rest of them. And I called you, and then you told me that the patient can recover, through plastic surgery and the rest of them. So, can you share a brief story about, a patient that made a significant progress through physiotherapy? Just brief, a minute on that.
Now you mentioned burns. Let me start with burns. I have a couple to share. But because you've talked burns, let me mention burns. When I was immediately after graduation, I was working in a hospital. And we had this burns patient, a woman. She was preparing for her traditional marriage, which was fixed like 4 months. And she had first degree burns. And she never knew she was going to recover. The hot water splashed on her. And all the joint, because she was lying in sticking together. So when I was called in to treat her, I told her that by staying like this, you are going to have joint stiffness and contracture. We need to be stretching the skin. It's going to be tearing, you see blood, but at the end of the day, you have your full range of motion. She agreed and went to do work. It was a gory sight, blood everywhere, but she kept on at it. Then after some time, she made some progress, and I left the hospital, got a job elsewhere. Then one day, somebody came to the new hospital and gave me an invitation card. I was wondering, I never knew you before. She said, "Do you remember so and so patient? It's me. I'm inviting you for that marriage." And she was, hell, I hate it. Yes, you can see a few signs of burns on her skin, but she was okay. Now let me share one with you. I had this patient that drove to a hospital. He was feeling weak on one part of his body. Drove to the hospital. By the time they finished all they had to do, opening the file, doing this, it became a full-blown stroke. He couldn't drive again. He ended up being on a wheelchair, wheeled out, so somebody had to drive him home. And he swore that it would never happen to him. So I took up his case, was treating him. We gave him exercises to do, things to do. He said whatever it will take so that he will never sit on a wheelchair again, he will do it. And within 3 months, complete paralysis of one side, hemi, went away. Yes, the physicians gave him drug for the high blood pressure, for the cholesterol, but on his own, he went overboard to do the exercises prescribed. Remember, exercise is medicine. You can overprescribe, you can under-prescribe, or you can even prescribe wrongly. But he did everything he needed to do. So these two come to mind, among others, of people that have made significant recovery. Because when we drop our prognosis, we say, okay, based on how you are doing, it will take us 6 months, 1 year, 2 weeks, 1 week to get a result. But you see people beating that timeline and making significant progress in a very short period of time because of their sheer determination and willpower.
Finally, Doc, before we let you go, we would like to know how do you stay current with the latest research and advancement in physiotherapy?
That is very paramount. It's very necessary because the world is changing and also the medical profession is changing. Currently, I'm enrolled in the National Postgraduate Physiotherapy College of Nigeria in sports medicine doing residency. So that's my area of specialization. In my hospital where I work now, every Monday we have physiotherapy presentation in form of a seminar. We present a topic and discuss it. And I'm also doing my Doctor of Physiotherapy program at the University of Montana, USA. So these three things and other read-ups I do here and there make me be abreast of the profession and stay current. And when a patient comes with a condition, I don't rely on residual knowledge. I still go and read it up because patients now know about their condition because they can go on Google and read up something. So it's for you to correct the impression they have if it's a wrong impression or to affirm it. So you yourself as a physiotherapist ought to be ahead. If not, medical profession will leave you behind because it's constantly changing.
Thank you very much, Doc, for your time. Before I think at this point we are going to let you go. We'll come back to you later. I believe that most of our viewers, we have questions for you in physiotherapy. What areas they can have their problem solved, and then probably bones patients, people that just got out of coma, stroke patients, and the rest of them. They are going to give us highlights on some of these areas when the time comes. We are going to have, I believe we are going to have a live session in a couple of days so that our viewers can personally ask you questions. Thank you very much. We invite you back on the show in due time. Thank you very much.
Thank you. Appreciate it.
It's been enlightening to explore the power of physiotherapy with Sir Aldrich-Bennett. Remember, movement is medicine, and we are grateful for the dedication of professionals who help us to heal and thrive. That's it today on Spotlight, sponsored by PASS. I remain your host, Aldrich Alex. Have a pleasant day. Remember, wealth is health. Bye.